So here we are going to talk about the positioning of the patient. And first one, if any patient have a asthma, what should be the good position for them? It is orthopedic position, where the patient is sitting up and bent forward with the arms support on a table or chair. Post bronchoscopy. So after the bronchoscopy, when we management of the patient, it is good to go for flat on bed with head hyper extended. And next here, if any patient develop the cerebral aneurysm, means abnormal or weakening of the arterial wall. In case of cerebral aneurysm, good position is high Fowler. High Fowler position means the degree above the 60 degrees. In case of hemorrhagic shock, it is good to the head of the bed elevated 30 degrees to reduce the intracranial pressure and also facilitate the venous drainage. Ischemic shock. Ischemic shock, it is good head of the bed should be flat. Cardiac catheterization, keep the side extended. If anybody have a nosebleed, it is called epistaxis. Okay, lean forward. Above the knee amputation and below knee amputation. Common question NCLEX board asks. Above the knee amputation, it is good elevate for first 24 hours on pillow. Position on the prone daily for hip extension. If anybody amputation below knee or below knee amputation, foot or bed elevated for first 24 hours and position prone daily for hip extension. Now, tube feeding for patient with decrease the level of consciousness. So then position of the patient on right side to promote emptying of the stomach with head of the bed elevated to prevent aspiration. In case of ear or pulmonary embolism, turn the patient to left side and lower the head of the bed. In case of postural drainage, like a fluid accumulate in the pleural space and we need to drain. Lung segment to be drained should be in uppermost position to allow the gravity to work. So during the lumbar puncture, the patient position should be lie down or sitting, but after lumbar puncture, what should be the ideal position? Patient should lie down flat in supine to prevent the headache and leakage the CSF, cerebrospinal fluid. Supine position means if anybody lie on their back, right? Usually supine position is good for neck injury, or if need long roll after the movement of the patient, it is good for go for supine position. But keep it note, during the supine position, patient chance to screen break down and lead to the ulcer formation. So continuous bladder irrigation. It is catheter should be trapped to thigh, so legs should be kept straight. Very important. And after myringotomy, position of the site of affected ear after surgery. So affected ear position should be the side. Post-cataract surgery. It is the surgery for eye. Patient will sleep on unaffected side with a night shade for 1 to 4 weeks. If anybody have a detached retina, so what should be their ideal position? Area of the detachment should be in dependent position. After thyroidectomy, so if anybody has a goiter, thyroid problem, need to remove the thyroid glands. So after surgery of thyroid glands or thyroidectomy, it is good to go for low or semi-polar. Low polar means less than 30 degree. Semi-polar means 40 to 60 degree. In case of thoracocentricis, like you want to collect the fluid from pleural space, thoracentricis, sitting on side of the bed and leaning over the table. Or after side up, it is good. After side up or after procedure, it is side up. If anybody have a spina bifida, position of the infant on prone. Prone position means, so if anybody lie on their abdomen, particularly spina bifida, prone position. So basically, if anybody have a abdominal surgery, keep in mind, prone position never for abdominal surgery or abdominal incision. Also, never for the patient who have a difficulty of respiration. It is not prone position for not for that. If anybody have a back traction, elevated the foot on the bed for counter traction. This is one kind of traction because of injury to the legs. Post total hip replacement, do not sleep on operated side and do not flex the hip more than 40 to 60 degrees and do not elevate head of the bed more than 45 degrees. And also it is good to maintain the hip abduction by separating thigh with pillow. If anybody have a prolapse cord, particularly during the delivery, the cord is prolapsed, it is good request mother for knee chest position or Tendelbach position. Knee chest position increase the oxygen supply to the baby and good for mother. Also, client in case of clipped lip, position on back or infant seat to prevent the trauma to the suture line. While feeding, always hold upright position. This is the question NCLEX board asks. In case of clipped palate, prone position, clipped lips, during the feeding, upright, otherwise on back. In case of hemorrhoidectomy, assist to lateral position. If anybody is a hemorrhoid, need to cut, this is called hemorrhoidectomy. Hiatal hernia, upright position, prevent the dumping syndrome. So if anybody have a surgically remove the part of the stomach, patient chance to develop dumping syndrome, how you can prevent it? It is the question NCLEX board frequently asks. So eat the Recycling position and lie down after meal for 20 to 30 minutes. Also restrict the fluid during the meal, low fiber diet, and small frequent feeding. If anybody needs to put enema, the position of the patient is left side lying. So left side lying, right? So now post supratentorial surgery, incision behind the hairline, elevated the head of the bed 30 to 45 degrees. Post infratentorial surgery, when incision at the nape of neck, position the patient flat and lateral or either side. If any patient increase the intracranial pressure, it is good for high polar posture above 60 degrees. If patient have to laminectomy, back as straight as possible, log roll to move and send back on one side. If any patient have a spinal cord injury, the first priority immobilization. Immobilized on spine board with head in lateral position. Immobilize head with padded C-collar. Maintain traction and alignment of head manually. Log roll client and do not allow the client to twist, right? In case of the liver biopsy, what should be the ideal position of the patient? Right side lie with a pillow or small towel under the puncture side for at least 3 hours. In case of pericentesis, after the procedure, we have to go for flat on bed or sitting. Intestinal tubes, if any patient need, it is good for place the patient on right side to facilitate the passage into the duodenum. If my patient need nasogastric tube for medication, for feeding, or any other purpose like aspiration, it is good. Elevate the head of the bed 30 degrees to prevent aspiration. Maintain elevation for continuous feeding or 1 hour after intermediate feedings. Now, pelvic exam. If anybody need to, pelvic exam, it is good for lithotomy position. So if anybody like a mother waiting for vaginal delivery or pelvic exam, right? On if the patient need to position for a long time. So like if the patient long time to change for blood clot, always lithotomy position is the good. Rectal examination, it is knee chest position, or we go for Sims position. Sims, like even we go for any maternal or fetal distress, Sims position also good. Enema, you need to put enema, Sims position. Or if you put any rectal suppository, it is good for Sims position. During internal radiation, patient should be on bed rest while implant is in place. In case of autoimmune dysreflexia, place the client in Sims position first before any other implantations. If your patient come to you after shock, always bed rest with extremity elevated 20 degrees, or knee straight or head slightly elevated. It is called modified Tendelberg position. Usually in Tendelberg position, head should be down, but extremity will be go up, right? And if patient has a hypovolemic shock or cord compression during the delivery, we always prefer Tendelberg posture or positioning. Peritoneal dialysis, when outflow is inadequate, it is good to turn the patient side to side before checking for kinking in the tubing. In case of myelogram, if it is water-based dry, semi-polar position. But if it is well-based, flat on bed for at least 6 to 8 hours. If patient have suspected ear dry, it is good to go for Tendelberg positioning.